your official Grey's Anatomy recap, Season 22, Episode 3. Two men in an operating room in scrubs looking at each other. The gas explosion that closed out Season 21 certainly turned Grey Sloan Memorial and its doctors on their heads for a bit. But 3 episodes into Season 22, it feels like Grey's Anatomy is back to business as usual. Of course, for this show, business as usual means risky surgeries, angsting over heartbreak, and finding a way to exude sexual tension even while in an or with another human being's body cut open in front of you. Oh, and also, apparently, shaking down car salesmen. Yup, just a regular Thursday in fictional Seattle. Let's talk. Between two lungs. Everybody, just breathe. Meredith's new work setup, in which she'll be spending summers operating in Seattle, also means that for a few months every year, Grey Sloan is gaining the services of world-class transplant surgeon Nick Marsh. These little cuties are a package deal. At the moment, Nick has a 6-year-old patient named Ryan with bronchiolitis obliterans. He's desperately in need of new lungs and has been sitting around on ECMO for what's now becoming a risky amount of time. Nick knows that simply hoping for a match from a deceased donor, the typical standard of care here, doesn't give Ryan much of a chance. Instead, Nick wants to perform a bilateral lung transplant from 2 living donors, Ryan's dads, Stephen and Vivek. Lung transplants from living donors aren't the norm. This is cutting edge and comes with some major risks. Even though Stephen and Vivek would each be giving up only the lower lobe of one of their lungs, they'd have diminished breathing capacity for life and could suffer infections or strokes. It's not some simple procedure. Still, even after Winston voices some major concerns, and he and Meredith go back to Ryan's parents to make sure they understand what the risks are, both Stephen and Vivek couldn't be more adamant that they want to do whatever gives them the best shot to save their son. Vivek, especially, is moved to tell his doctors that he has zero hesitation. He entered Stephen's and Ryan's lives when Ryan was only 2, and now he can't imagine his life without his son. It's very sweet and is a nice reminder of what they're working toward. As Nick says over and over, this surgery is about saving an entire family. Winston still isn't so sure this is the best course of action. He's nervous. Jules catches him ahead of go time getting hyped up with his little pre-surgery playlist. Release the playlist, Grays. But it turns out that isn't actually what gets Winston in the right headspace to save Ryan. The real push he needs comes from Jules. She's surprised to hear that her attending has so much humility and, to be honest, so many insecurities when it comes to his skills as a surgeon. Most surgeons have real god complexes. We know this. We've watched 22 seasons of Grey's Anatomy. She thinks that humility is what makes him such a good doctor. He's not looking to show off. He is there to give his patients the absolute best care he can. This means that when he hits an obstacle, he always finds a way through. As far as pep talks go, it's not a bad one. Although if these two are attempting to defuse the sexual tension between them, this is not the way as it happens. Jules' words portend what's to come the moment Ryan, Stephen, and Vivek are put under for their surgeries. Seconds before Nick opens up Vivek, they realize he has a fever, which means he must have some sort of infection. He can't be a donor. Not today, at least. The bigger problem arises when Nick goes to tell Winston, who is in charge of Ryan's surgery, that they need to call it off. Winston already took Ryan off ECMO, and he doesn't think someone as young as Ryan could survive being put back on it. There's no good way out of this until, well, what if they cut Stephen's one lobe into 2 pieces and fit those into Ryan to act as his lungs? It all comes down to Winston, king of lungs. Can he do it? He does some quick math right there in the OR with everyone watching him, which, honestly, is more impressive than anything else I've ever seen in all 450 episodes of this show. It all adds up, and with some eyes passing between him and Jules seemingly saying, "You've got this," Winston tells them it's possible. And guess what? It is. Once again, Winston's skills save the day, and Ryan's life. Later, he thanks Jules for her pep talk with a bashful, flirty face that screams something is going on here. Feelings are being felt. At least, it screams those things to Simone, who is now totally onto them. Thank God it's not just us and Weber anymore. There's another cute effect thanks to Ryan and his family. Aside from assisting with multiple lung transplant surgeries, Meredith is spending the day bugging Nick about something Boyd Bailey confided in him. It doesn't matter how much Meredith tries, Nick refuses to break Boyd Bailey's trust. But as Meredith spends more time with Vivek, she's reminded how lucky she is that her kids have such a close bond with Nick that they can trust him with the big, important stuff. Listen, I still want to know what Boyd Bailey is up to. Is he dating someone? But it is admittedly quite lovely to see this family unit working so well after everything they've been through. When Miranda Bailey worries, we all worry Miranda Bailey is having a good day. Excuse me, was having a good day. You see, it starts out full of fun pastimes like watching her newly installed chief resident husband celebrate his big promotion, getting to see him bond with her second dad/best friend interim Chief Weber over their chiefdoms, and getting to remind both of those fools that being chief comes with mountains of paperwork. By the end of the day, both Ben and Weber come to realize that once again, Bailey was right. But that's about as good as the day gets for Miranda Bailey. Not long after, one of Bailey's patients, who is about to undergo chemotherapy for stage 2 gastric cancer, arrives at Grace Sloan in an ambulance after getting in a car accident. Katie has some internal injuries and will need a splenectomy, and while this will certainly push back her chemo treatments, over and over again Bailey reminds her that the only time she should start to worry is once Bailey looks worried. Bailey does not look worried yet. Well, to be fair, she looks kind of worried, but that's less about Katie and more about the obvious tension between her two residents Lucas Adams and Wes Bryant. At the start of the shift, a still quite sour Lucas finally says out loud what all of his curt answers and eye rolls have been screaming at Wes. I'm angry at you because you slept with my girlfriend. Of course, when Wes goes to Simone and tells her she should have at least given him a heads up, she clears up the situation. She didn't cheat. She and Lucas were not together when she and Wes found themselves tangled up in the bathroom at Joe's. Lucas is just taking this hard. Some may call him unreasonable. Some may have other choice words for the way this full-grown adult is acting. This, of course, only makes things more tense between Lucas and Wes and only makes Bailey's job harder. Eventually, she has to separate the two, and while in surgery, she sends Wes on an errand, relegates Lucas to retractor duty, and reminds the troubled second-year resident that his emotions have already gotten him kicked out of the OR once this year. He needs to get it together. Lucas doesn't have time to defend himself because the moment he looks down at Katie's liver, he notices tumors growing on it. Her cancer has spread. When Katie wakes up from her surgery, she doesn't even need Bailey to tell her the news. She can see it all over her doctor's face. Bailey is very, very worried. They'll need to run some additional tests so they can restage Katie's cancers, but it does not look good. Now, that's a bad day for everyone involved. Hey, at least by the end of the shift, Bailey can see her words to Lucas getting through. He sets aside his feelings to actually start teaching the intern. That's some kind of win. Speaking of bad days, Quan really makes a mess of things with his new plastics fellow Kavita Mohanty, played by newcomer Anita Kalathara, doesn't he? Quan's riding high. He believes he's finally figured out his specialty, and he's going to be on the new Plastics Fellows service that day. To make things even better, he gets to put a new intern in her place to start off the morning, even better than a cup of coffee. It's not long, however, before Quan realizes that the intern he told off is actually the new Plastics Fellow, Dr. Mohanty. I'm sorry to tell you that things don't get better from there. He repeatedly makes her day harder, messes up with their patients, and by the end of the shift, the only advice she has for him about how to make things better is to stop talking. That's going to be a tough first impression to to erase. Please don't forget to like, comment, share, and subscribe for more videos. Thanks for watching.